Hey guys, this is Dr. Raj Banerjee, international best-selling author of Stem Cells, The Healing Revolution, and I have a special treat for you guys. So I get asked this a lot about what's the difference between doing major surgeries and having stem cells done. And so I'm going to make a quick video for you so you can kind of see. And you know, when we become doctors, we take an oath, and this oath is called the Hippocratic Oath, which basically tells you do no harm, right? So I'm going to go over the options that most people get, most of my clients get, and you'll see where, you know, what kind of options are going to be good for you. So check this out. This is cool. We got a whiteboard here, and you can see, you know, we got major surgeries versus stem cells. Then basically what we're going to look at is if it's going to make your arthritis, if it's going to make your pain worse, if it's going to give you a false sense of healing, the side effects, complications, the quality of life, the cost, and we're going to go through this whole maze here that most people go through, but their doctors never sit down and actually explain, you know, what the other options are. So we're going to do that in this video. So let me put this on the stand here, and one of my team members is going to help me so we can see everything. Okay, here we go. All right, so let's do this. So major surgery versus stem cells. Okay, so here's the thing. Knowledge is the key to success, right? And when most of my patients and clients, they have arthritis, they have pain, joint pain, they're sitting next to the doctor's giving them some options. And usually if you have bone on bone, what my patients are telling me is that they're going right to, you know, the option of surgery. So again, you're going to see that there's a lot of other options out there, and if these options are going to be beneficial for you. So we're going to go through these, you know, if it's going to make the arthritis worse, if it's a false sense of healing, the side effects, quality of life, the cost, and we're going to go through this whole thing. So let's start. So let's just say that, you know, you start getting arthritis. The first thing that you'll notice what they do is basically the option is non-steroidal anti-inflammatories, right? That's what you will get. Is that good for you? So let me look at some research here. So basically, one of the reasons that people will jump from non-steroidal anti-inflammatories into this and go into the major surgery is because the non-steroidal stuff really doesn't work. And if you look at some of the side effects, and I'm going to read through some of the side effects here, one of the major side effects that it will do is it actually accelerates your arthritis. So the drug that you're taking, you know, for you to help the arthritis actually makes the arthritis worse. It perpetuates it. So how does it do that? It dries out the joint capsule. So what does that mean? That means the blood flow that's supposed to go into your joints, you can't get the blood flow in there, so you can't get nutrients in there, and you can't get the waste products out. So the joint, you know, the joint is actually an organ, right? So it actually deteriorates even faster. So you go through that. So does it make the arthritis worse? Yes, it does. It gives you a false sense of healing because, again, it doesn't really heal anything. It perpetuates, actually accelerates it. It accelerates the damage. The side effects, complications, so let me read you some. So this is some of the side effects. Non-steroidal anti-inflammatories raise your risk for having heart attacks and strokes, especially at higher dosages. Also causes stomach bleeding, stomach pain, heartburn, stomach ulcers, headaches, dizziness, ringing in the ears, allergic reactions like rashes, wheezing, swelling, liver and kidney problems, leg swelling, high blood pressures, and like I said, it accelerates the arthritis. So quality of life, well, I mean, if it makes things worse, the quality of life, you're taking more and more of these non-steroidal, it's affecting your liver, people are getting ulcers and things like this, so it actually makes the quality of life worse. And the cost, again, what's the overall cost with these things? I'm going to go over the major surgery cost, you know, when I flip this board over, but again, the cost gets higher and higher because it never fixes the problem. So as far as the non-steroidal stuff goes, let's use a red marker here. This, as an option, is not the best option. Then the next one is, let's say that doesn't work, you go and do the Synvis. There's many different names for it, many different brand names. The Hyaluronic Acid, basically what it does is supposed to put some viscosity into your joints. There's many names for this, like the rooster shots, the chicken shots, you know, rooster comb injections. And basically, does this thing work? What the research is showing us, it actually doesn't work. It actually, again, accelerates the joint process. In fact, There are, and if you look on the web, there's certain websites where the American Academy of Orthopedic Surgeons are writing that it's a complete waste of time, complete waste of resource. And you know what the alternative is that they're saying? They're saying, don't even do this, just go get the major surgery done right from the bat. So they don't even give you any other options, which again, I'm not telling you to do. So basically, that's what they're showing. It's a waste of money, waste of time. Again, you're gonna hear this from your doctors. It's gonna buy you some, what? Buy you some time, because they already know this maze here. You go through this process, it's buying you a little bit of time before you hit the major surgery, okay? So in the long run, it doesn't work. And what it actually causes flare-ups, it causes, they did these studies where randomized studies where they basically, it was 89 different studies they did, and they had to discontinue, many of these people had to discontinue the study because of the flare-ups and some of the adverse reactions they got. So again, not the safest. So let's use the red marker here. Cross that off. It doesn't work. It's a waste of time according to a lot of surgeons. Next is cortisone shots. This is very, very common. A lot of my clients and patients get this done, and their doctors never tell them exactly what some of their long-term effects are going to be. And again, in my opinion, the reason that people are getting these major surgeries is because they're taking too much of the cortisone shots. Again, think about it. Like if you ask your doctor how many times can you take these shots, some doctors will say 3 times for your whole life, and some will actually do 3 times per year. And what the research is showing is that it actually damages the cartilage. It actually causes the cartilage to die out. So it punctures holes in it. It actually accelerates the process. It's almost like if you look at 2 different X-rays, let's say you look at 2 ankle X-rays or hip X-rays, and they both have arthritis in it. The ones that gotten the cortisone shot, it looks like someone put acid in there and it's just dissolving that whole area. It damages it that much. And people think like, well, after a while, your body just rejects it. It's not that your body rejects it. It literally damages the tissue so much that there's nothing for the cortisone to work on. So let me kind of go over and again, in my opinion, the reason people are getting so many of these surgeries is because their doctors are over-prescribing the cortisone shots. And this is exactly what the research is showing. So when injecting the joints, the corticosteroids not only trigger the cartilage cell death, but it completely suppresses your healing response. So again, does it make the arthritis worse? Yes. That is a false sense of healing. Here's how it's a false sense of healing. Let's say that you injure your ankle or your knee, right? And if that joint is injured and you play basketball or you hike, that's going to stop you from doing it because it's an injured joint. So you're not going to do that, right? So let's say you go to the doctor and you get a cortisone shot. The pain is gone, but is that joint better yet? Is that joint healed? No, it's still damaged. So now you don't feel the pain, but now you're hiking, or you're playing basketball, you're jumping on an injured joint. What's that going to do? That's going to accelerate that damage. Does that make sense? So again, it's a false sense of healing. It accelerates it. Side effects, complications. Well, let me read you some. Cortisone has a harmful effect on soft tissue healing, inhibiting blood flow. Again, you don't get the blood flow in there. So what does it do? It perpetuates the arthritis, perpetuates the damage. You can't get nutrients. You can't get the waste products out. Inhibits blood flow to injured areas, suppressing new blood vessel formation, suppressing growth and immune cells. It also inhibits release of growth hormones. So it further decreases soft tissue and bone repair. So basically, it's a catabolic substance. So catabolic means it eats away, it destroys, it's a destructive substance. It weakens knee cartilage. Also, it's a high risk. It actually increases the risk for the major surgeries. And it also increases the risk for secondary surgeries too. And also, it alters the healing environment of the joint. And it predisposes your joint to infection. So again, so many negatives to this that you really want to be careful not abusing. Short term, it might be okay, like if you know the short term, as far as you just do it once and your body's flared up, but having it done to your joints over and over and over again, it's just so destructive to your body. So the next is the arthroscopic cleanup surgery. So let me give you an example of this. So let's say that you got bone on your knees, you got the cartilage, meniscus that's, there's like these little pieces that's floating around. So what they do, they go in there, arthroscopy, it's a cleanup surgery, right? They take out the little pieces, they cut out the cartilage, and what are they doing? They're scraping off tissue. So you have to ask yourself the question, how many times can you scrape off cartilage and meniscus and tissue before there's literally nothing left there? And it's literally bone on bone. So again, this actually accelerates, so you have to have the major surgeries. So another way to think about it is there's like 4 walls in this room. Let's say there's damage on that wall and you get a surgeon to clean it up. What do? They scrape off that wall. Now you got damage on that wall, they scrape off that wall. You got damage on that wall, they scrape. What's going to happen to the roof after a while? It's going to cave right in, right? So what's going to happen to your knee, your ankle, your hip after they start scraping off these tissues? It's going to cave right in. And what the research is showing is that, again, they did these research where they used placebo, where they just did the incision, they didn't do any cleanup, and then they had other patients where they actually cleaned up the arthritis and all these other stuff that they saw in the MRI. And what they found is that the people that had less of the cleanup, they actually did better. So here, let me read you this. So basically it's saying that the study says that you can't, arthroscopic knee surgeries is not a gap. So it doesn't give you that gap here. It actually accelerates the major surgeries. And what happened is that the cleaning out, the clipping, the smoothing of any dislodged cartilage found in the knee, doctors believe that it's actually helping the patients, but when you actually look at the research, it actually damages the patient. So this new study finds that practice does not benefit the patient. Patients who do not have dislodged cartilage removed recover faster. So if you don't get the surgery done, you recover faster. And what they're saying is that the whole joint is an organ in itself. You need the stuff that's floating around that they're removing, you actually need that for that joint to heal. So again, this is a big no-no because it actually speeds up the process where you're going to need this major surgery. Now let's talk about these major surgeries. Because one thing that we want to talk about is these major surgeries is that, for example, in June 30th, 2014, this was published in the Medical Journal of Arthritis and Rheumatology. And what they're saying is that 1/3 of the surgeries that are performed basically should not have been performed. Okay? So here's what they're saying. The Agency of Healthcare Research and Quality reports that over 600,000 knee replacements are performed each year in the US. In October 2015, an editorial appeared in the New England Journal of Medicine. This is one of the prestigious journals out there, right? They said about 0.5 to 1% of patients during a 90-day period, post-operative period, die. So we're looking at, if it's 600,000 patients and 0.5% to 1%, that's 3,000 to 6,000 people die each year from knee replacement surgeries. My dad almost died from this, and I told you the story in one of the other videos, but basically they wanted to replace both his knees because they're bone on bone. They didn't give him any other options, and so I talked him out of doing both knees at the same time. He did the right one, and he almost died during the surgery. And so again, we're seeing over 3,000 to 6,000 people each year die from this. The procedure is not universally successful, so 20% of people that go under this, they actually get worse. And they're never told other alternatives. And I want to kind of compare some of the cost here. So I want to flip this over. Let me see. Flip this over. And check this out. So cost for surgeries, a knee replacement, these are average costs based on what kind of hardware you're going to use. $45,000 to $85,000. Hip replacements, 50 grand. Shoulder replacements, 25 grand. Lumbar fusion, 169,000. This is like one of the worst surgeries you can get. I've been in practice for 19 years, seen over 8,000 patients. Majority of the people that had this surgery, they are not happy with it. And in fact, they're doing worse. And what I'm seeing in my practice is that, let's say they do L3, L4, or L4, L5, let's say the pain goes away. 2 years later, the pain comes back. They're sitting next to their surgeon, and guess what the surgeon is telling them? That they have to fuse the one on the top. And I have patients where they literally fuse from the lower lumbar and all the way up, boop, boop, their whole lumbar spine, their whole cervical spine. And why not? 169,000 a pop, right? And that's not the only thing for the cost for surgeries. You're still got to look at the weeks and months of rehab that you got to go through. You got to look at the complications. I just went through some of the complications. But here I just written 3, blood clots, errors, death. But there are more complications. There are bleeding, there's wound complications, blood clots, nerve damage, instability of the joint because it damages the ligament, misalignments, there's stiffness, there's deep joint infections, fractures, implant loosening, the implant dislocating, need for revision. So these surgeries, do they last forever? That's another question you have to ask yourself. So you need to, and the other complication is death. So doctors in Harvard Medical School released a study, this is October 2015, that has showed that heart attacks increased way, way higher after following surgery, okay? So again, the complications are there. And again, the question is, do they last forever? I've seen these replacement surgeries last for 5 years, 10 years, 15 years, but here's the problem. At some point, they're gonna have to get this whole thing done again. And at that point, they're 10, 15, 20 years older. Their body's not as strong. And they got to go through this major surgery, this whole trauma to their body. And again, with all the complications stacked up. So again, is it really worth it? And I put this here. You're going to see on the screen, I'm going to put up a slide here, 53%. So what they have seen is that 53% of these surgeries are ineffective in clinical trials, meaning that you get the surgery, you do the rehab, and you're still in pain. And worse off, there might be complications, there's scar tissues, there's all these different things that you have to deal with, right? So again, is it really worth it? So what is our other alternative? Which I didn't write down here, but I think you already know. It is stem cells, right? So again, regenerative medicine, tissue, and stem cell therapy. So stem cell. Okay, so this is going to be our major alternative here. And here's the thing with stem cells. This is the newest breakthrough in joint medicine where there's no drugs, there's no surgery, there's no downtime, and this is the only thing that's going to actually regenerate tissue. There's so much research behind this. Our medical team, in the last 2.5 years, we've done over 21,000 cases already. And as far as the side effects go, the only side effect that we're seeing with stem cells is you might be a little tender in the injection site. So again, this is a viable option. So if your doctor has not given you this option, this is a viable option. The thing is, where are you getting the stem cells from is a major thing. And what you do afterwards is going to be a huge thing as far as the success of what you want with the stem cells. So that's why I've written this book, Stem Cells, The Healing Revolution. And I would like to give this book to you for free. All you have to do is pay a small shipping charge. So you're going to learn that which stem cells work the best, the type of stem cells that are getting 95% success rate, 7, 9, 18 months in, the type of stem cells that are working to actually regenerate tissue, the type of stem cells that are not going to work. In fact, if you have bone on bone, if you are over the age 50, there's a type of stem cells that you really should not use at all. It's all in this book. We cover case studies, we cover the science, we cover the history of stem cells, the research. We even talk about what you do afterwards. So again, we want to stack everything in your favor. So when you get the stem cell therapy and regenerative medicine therapy, this tissue therapy, that you know exactly what to do. So again, you're not putting fuel to the fire, you're actually helping your body heal faster. It's all in this book. I'd love to send it to you for free. Again, just pay a small shipping charge. There's going to be a link in the bottom that you're going to see. Click the link. We have a limited supply, so please get your copy today. And you're going to learn so much. And if it's going to be you or your family that needs to know this, please get a copy of this book because it's going to give you more options. Thank you so much. Hope you enjoyed the video, and I'll see you soon.